Welcome back. This is the More About T2 meeting of Prevent T2, the CDC's Lifestyle Change Program. Today, we are going to learn more about type 2 diabetes. Before we begin, look at your action plan from the previous session. What went well and what didn't go so well? You've been working hard to prevent or delay type 2 diabetes by losing weight and being active. Today, we will learn more about that disease. Some people who go through this program may still develop type 2 diabetes, but from what you have learned in this program will help you successfully manage type 2 diabetes. We'll talk about the basics of type 2 diabetes, how to find out if you have type 2 diabetes, and how to manage type 2 diabetes. Let's start with a review of the key facts. Please turn to Basics of Type 2 Diabetes on page 3 of this module's handouts. Let's review what type 2 diabetes is, how it can harm you, and the risk factors that make you more likely to get it. Basics of type 2 diabetes. In people with type 2 diabetes, the body doesn't make or use insulin well, so sugar builds up in their blood instead of going into their cells. That means the cells don't get enough energy. Over time, high blood sugar can cause many health problems. Type 2 diabetes can harm you. It can harm your heart and blood vessels, which can lead to heart attacks and strokes, nerves, kidneys, which can lead to kidney failure, eyes, which can lead to blindness, feet, which can lead to amputations, gums, and skin. You are more likely to get type 2 diabetes if you are too heavy, such as overweight or obese, spending a lot of time sitting or lying down, have a parent or sibling with type 2 diabetes, are African American, Hispanic, Native American, or Asian American, are 45 or older. This may be because people tend to be less active and gain weight as they age. But type 2 diabetes is also on the rise among young people. Or if you had diabetes while you were pregnant, which is called gestational diabetes. We've reviewed the basics of type 2 diabetes. Now let's discuss how to find out if you have it. Most people who are in the early stage of type 2 diabetes don't have any symptoms, so they don't know they have it. The best way to find out if you have type 2 diabetes is to have your blood sugar checked. It is important to get your blood sugar checked by a healthcare provider on a regular basis. That's because the sooner you find out you have it, the better you can manage it. That way, you can prevent the health problems we just talked about. Most people with type 2 diabetes have eating and fitness goals very much like yours. Like you, they are trying to reach and stay at a healthy weight. They may also track their eating and activity. Unlike you, most people with type 2 diabetes check their own blood sugar daily or weekly, and they track the results. Many people with type 2 diabetes also take medicine to control their blood sugar. Some take pills, others inject medicine. People with type 2 diabetes visit their healthcare provider often. They also have many lab tests. In addition to getting their blood sugar checked, they need to get their blood pressure, cholesterol, kidneys, eyes, and feet checked on a regular basis. The goal of managing type 2 diabetes is to keep your blood sugar in a healthy range. Let's look at an example. Please turn to Mike and Henry's story on page 4. Mike and Henry's story. Mike is at risk for type 2 diabetes. He's trying to prevent or delay it by living a healthy lifestyle. Mike's dad, Henry, has type 2 diabetes. His goal is to keep his blood sugar in a healthy range. Mike and Henry have very similar eating and fitness goals. They are both trying to reach and stay at a healthy weight, and they both track their eating and activity. Unlike Mike, though, Henry checks his own blood sugar each day, and he tracks the results. Henry also takes pills to control his blood sugar. Mike and Henry both keep an eye on their health, but Henry visits his healthcare provider more often. He also has more lab tests. In addition to getting his blood sugar checked, he needs to get his blood pressure, cholesterol, kidneys, eyes, and feet checked on a regular basis. Mike has lost weight, and his last blood sugar numbers are normal. His provider says he's on track to prevent or delay type 2 diabetes. Henry's latest blood sugar numbers are normal too. His provider says he's doing a good job keeping his blood sugar in a healthy range. How would your life change if you had type 2 diabetes? If you had type 2 diabetes, you might need to track your blood sugar, take medicine, and have more provider visits and lab tests. So what will you do to prevent type 2 diabetes? In order to prevent type 2 diabetes, you may work harder to meet your eating and fitness goals, and track your food and activity. Please look at your action plan journal and spend a few minutes making a new action plan. Keep in mind what worked and what didn't work well for you since our last session. Are there any changes that you want to make? Also keep in mind what we learned today about type 2 diabetes. Remember to keep your action plan realistic, doable, specific, and flexible. Before our next session, look at life with type 2 diabetes on page 5. Between now and our next session, think about how your life would change if you had type 2 diabetes. What will you do to prevent it? Write down your own thoughts. And as always, submit your weight and physical activity before our next session. We have come to the end of our meeting. Today we learned more about type 2 diabetes. We talked about the basics of type 2 diabetes, how to find out if you have type 2 diabetes, and how to manage type 2 diabetes.